Hi, everybody. It's Allison. I'm back. Just wanted to, again, thank you guys for your patience and welcome to the benefits open enrollment for 2020. Just so you all know, the benefits will begin on July 1st and will run through June 30th. You can go to the next slide, Wanda. We're going to talk about several different types of benefits today. It's going to be medical, dental, and vision with your Care First as your carrier, and the life, short-term, and long-term disability with Principal as your carrier. There's a couple of other great work-life balance programs that we're going to touch on later on in the program that are also available through Principal. Next slide. So again, welcome. As I was explaining, you're going to have medical, dental, and vision with Care First. Your plan year will run July 1st through June 30th of next year. Now is the time to sign up. If you are already on one of the plans offered through the company, please make sure that you're completing an enrollment form and getting that over to the, uploading it to the HR drive. We're going to talk about that in a second, but that is all due on Wednesday next week. So Wednesday, July 17th. You have 3 medical plans being offered through Care First. One is HMO HSA, another one is the Advantage POS HSA, and then there's another one that is the Blue Preferred PPO. You have 1 dental plan and you have 1 vision plan. So I believe some of you all have never been offered vision before, so this will be a new benefit for you guys. The life and disability is offered through Principal. And then the other thing that we're going to touch on a little bit throughout this presentation is the fact that your plans are high deductible plans. So you have the option of doing an HSA account. And new this year, the employer will be making a contribution towards your HSA account, which can be used towards your deductible and your co-payments, any kind of out-of-pocket that you might have on your medical, dental, or vision expenses. You have $25 for an employee. And then if you have dependents, so employee spouse, employee child or children, and family would be $50. And that is all on a monthly basis that'll be contributed towards your HSA account. And again, we'll talk a little bit more about how all that's going to work as we flow through the program today. So the 3 plans that you have on medical is you have a Blue Choice HMO HSA, and that is the plan that is available if you reside in Maryland, DC, or Northern Virginia in a certain area that is east of Route 123. Not sure who isn't muted, but if you guys could mute yourself, that would be great. Thank you. So the HMO plan, like I was stating, is offered for the people who are located in the state of Maryland, District of Columbia, or in a certain portion of Northern Virginia. So it's going to be like Arlington, Alexandria. If you all are located in that, what they call the Care First service area, then you have the option of choosing this HMO. If you are anywhere outside of that area, then the Blue Choice HMO is not an option for you. And if you accidentally sign up for it, Wanda will be paying attention to that. So we'll get on a call and counsel you on what would be a better option for you. This is a true HMO, does not have out-of-network benefits unless it's an emergency or urgent care. And you must use Blue Choice network providers. The second plan is a Blue Choice Advantage. This plan is kind of a hybrid plan, and it's a really cool option that CareFirst is offering for people because they realize that the Blue Choice HMO plan or the PPO plan might not be the best option for an employee cost-wise. So you normally, back in the day, if you were outside of their service area, so your Illinois employees, you would just automatically have to choose the PPO. No questions asked. You couldn't choose an HMO. There was nothing else for you. So a lot of people got in the mindset of, oh, I have the PPO because I'm not near my employer. So CareFirst came up with this plan, and they call it the Advantage Plan. And no pun intended, but the advantage of the Advantage Plan is it works very similarly to the PPO plan. So you have access for in-network providers and out-of-network providers. So you don't have to necessarily choose the PPO plan. The PPO plan is going to give you the national network of doctors, absolutely. It's going to give you the biggest network possible. But when you're out of the area with CareFirst on the Advantage plan, you get that same network you would get on the PPO plan. So the advantage to choosing the Advantage plan over the PPO plan is you get the same network, no different. And you're going to save money on your premium. That's the big thing, because, you know, when you have money coming out of your paycheck for premium, that's hard cost. That's money that's always going to come out of your pocket. That's not something that you can change. Whether you use the plan or not, that money coming out of your paycheck is going to come out regardless. So if you can save a little bit on your premium dollars on those hard costs and get a very similar plan to the PPO plan, then why wouldn't you? You're going to have the same doctors as what you would have under the Blue Preferred, save a little bit of money. So anyway, we're going to talk about the differences between the plan designs as in a little bit more detail, but kind of wanted to talk about why you would choose the Advantage plan over the PPO plan when you're not in the CareFirst service area. So again, the first two plans are within the service plan area, and the third plan, obviously the PPO, is national, so it's all across. But plan 2 also crosses over for those out-of-network people. Well, out-of-area people, I should call them. Okay, so then you also have the Blue Dental Plus plan and the Blue Vision Plus plan. Just want to touch real quick on this next slide, which just gives you some ideas of what is a qualified event. A lot of people don't know, so you can always reference back to this. The way insurance works is you are...
Ashley, what slide are you on?
Oh,
I'm sorry.
We should be on
We're good.
Okay, are you caught up?
Yep.
Sorry about that. When are you eligible to change your benefits? Now is the time. If you're signed up and you don't complete a form, then you need to then technically you're not going to have benefits starting July 1. If you're waiving the coverage presently and you would like to join, now is the time. Otherwise, the only other times you can join is if you have a qualified event. You're in this plan for the entire year unless you have something that changes it. Next slide. So what do you have to do? You need to fill out a CareFirst Blue Cross Blue Shield enrollment form if you want to join medical, dental, or vision. So you can choose the medical, not the dental and vision. You can choose the dental and vision, not the medical, or you could just choose vision or dental or medical. You can choose any of the three, doesn't matter. If you are totally waiving all of the benefits with CareFirst, then we need a waiver form, please. That's all located on the HR drive. The principal enrollment form If you have filled out a form in the past with the company, we're just asking, because we're starting a new year, we're changing some carriers, that you go ahead and fill out the principal enrollment form so that you can update your beneficiary, please. That again is located on the HR drive. If you have any questions about your insurance, what kind of plan you'd want to choose, anything like that, please reach out to Wanda and she'll set up an appointment with me if you have questions that she can't answer. She's extremely knowledgeable, so hopefully she won't need me that much, but I am here if she needs me and you guys need me. Next slide. Actually, you can skip that one. We're just going to talk briefly about your principal plans. You have life insurance, short-term and long-term disability. If you skip to the life insurance coverage slide, your benefit is 1 time your annual salary up to $500,000. You have life and you also have accidental death and dismemberment insurance. If something happens and you pass away and it happens to be part of an accident, then whatever your benefit is for life insurance, you get that same amount for the accidental death and dismemberment side. You also have an accelerated benefit that is baked into this plan, that in the event you have a catastrophic illness and need some assistance financially, you can tap into this life insurance plan. If you are approved, they'll give you a certain portion of the life insurance plan up front. But just know, if you do tap into this to help offset some of your expenses, then the amount that your beneficiary would receive at the time of your passing would be reduced by the amount that you took out to help you continue to live as comfortably as possible. Our next slide explains the short-term disability coverage. So you have 60% of your salary up to $2,300. Sorry, I'm just answering Wanda. She had a question. No, Wanda, I am running it on my own laptop and I had to get out of the Zoom meeting. So you should be on the short-term disability coverage slide showing the 60%. So you have 60% of your salary up to $2,300 on a weekly basis. That pays if you are injured after the first day. So if you have a sickness, then it pays after the 8th day. So if you have a sickness and if you have a pregnancy claim that's considered under the sickness, they didn't know where else to put it because we all know that that's not a sickness, but you would have the first 7 days that would be a waiting period. So that would come out of your personal PTO. And then at that point in time on the 8th day, your benefit would kick in. This pays up to 13 weeks. If it's a sickness, then it's going to pay up to 12 weeks. And this is an employer paid benefit, so there's no cost to you. You would file your claim if you were approved for, 3 weeks, 6 weeks, whatever it is you're approved, and your physician has to fill out a portion of the form. So if this happens to you, just reach out and Wanda can get you the appropriate form. Next slide, please. This talks about your long-term disability. So this particular coverage dovetails in with your short-term disability. You get 60% of your salary up to $9,500, and this is paid on a monthly basis. So while your short-term disability is paid weekly, this is paid monthly because they anticipate you being out, for weeks at a time. So they're only going to reimburse on a monthly basis. This kicks in after 90 days of being disabled. So that's what you have your short-term disability for. And it pays to what they call Social Security normal retirement age. So whatever age Social Security says that you're eligible to retire, some people, depending upon when they're born, it's now 67 that they wouldn't get Social Security. So if you were totally disabled and not able to go back to work, this plan would continue to pay you even though you're no longer an employee of the company. up until either you are eligible to work again or until you are at Social Security retirement age. This benefit is no cost to you as an employer, so both the short-term and long-term disability are nice perks that the company is providing you guys. So our next slide talks about the Employee Assistance Program. This program is available 24/7. It's available to all your family members. It is available for counseling. So that's what normally people say, oh, we have an EAP, you know, it's for, you know, if I need to talk to somebody. Yes, it is for that. But it also has a lot of references. It can give you legal and financial resources. It's not going to give you advice, obviously, but they'll give you some resources that you can go to, maybe some avenues that can assist you if you need that type of assistance. You can also use it for maybe finding some information about, you know, childcare, or maybe you have elderly parents and they need to go into assisted living. There's lots of great resources available in your employee assistance program, and it's at no cost to you to tap into it. So please don't forget that they are available 24/7, and that information is available on a flyer located on the HR drive. This next slide talks about another perk that's available through principals for the staff, and it's will and legal documentation preparation. These are free online resources that you can utilize to draft a simple will, help you with some estate planning, maybe some identity theft prevention, you know, just help you with your financial well-being, anything that you would need. The cool thing about this is that they use a program for will prep that is very similar to TurboTax. So it walks you through doing your own simple will and can save you, you know, hundreds up to thousands of dollars of creating your own will if you just need a simple will. Obviously, if you have a lot of other moving components, you'll need to go speak with an attorney. But for a lot of people, they just need a simple will on what can happen with the belongings that I have. Everyone really should have a will so the state doesn't make any decisions for you. You would print it off, sign it, make sure you get it notarized. So you need to go to a notary before you sign it, and then take it to the courthouse, file it so it's on file somewhere, and then give it to, you know, your spouse or trusted family member or friend to hang on to a copy. So there's no cost to do this simple will, except for the fact that when you go to the courthouse, if there's a fee to file it, you would have to pay that. But it definitely saves you hundreds of dollars as a free benefit for you. This last slide that we are talking about that principal offers you is travel assistance. So if you are traveling and you need personal or medical assistance, maybe, you know, your baggage got lost, or maybe your passport got stolen. Maybe you had a medical emergency, or a family member had a medical emergency, and you need to try to get them back home, or you need to get to them. All of that is available through this service. They can also give you information about where you're going. So maybe you're going to a country you've never been and you need some culture, you want to learn some cultural things about this particular society. And they can give you all kinds of suggestions of maybe where to stay, where to go, where not to go, that sort of thing. And then, of course, like I was saying, they'll help you if something would happen and you need to get home. They do have emergency evacuation services. As I explained to the people yesterday, we had a client that had a family member, have an accident while they were out in California. And they finally reached out to the patient's employer, and who contacted us and said, how can you help? And we referred them to their travel assistance program. And that program was able to bring that employee family member home. So they didn't have to be trying to do stuff long distance. So all of these are little perks that are available to you. They don't cost you anything. They're just resources that are great to have. Wanda, did we have any questions with the life, short-term, or long-term disability from anybody? Okay, thank you. Okay, so we can move on to Care First. Welcome to the Care First portion, which is the meat of this meeting today. The very first slide talks about what Care First is all about. They have a regional presence. There's also a national presence, and their regional presence is very strong. So anyone in the DC area, you're going to see that 100% of the hospitals participate. Almost 99% of the physicians are in network. So very strong presence in the area around Washington, D.C. For our national staff, the next slide shows that it also has a very large presence across the United States. 95% of the physicians are participating and 96% of the hospitals are participating, which is really good when you think about how many states and how many rural areas Blue Cross Blue Shield is going into, that they're able to capture that many physicians and hospitals. So you should be able to find someone and stay in network with the Blue Cross Blue Shield, no matter where you are located in the United States. So Wanda, if you want to skip to the second slide, it's a little boy on the page talking about the primary care physician. Just want to remind everyone that none of these plans require you to choose a primary care physician. None of these plans require you to get any referrals to go outside of the primary care physician's office. So if you want to go to a dermatologist, you pick one who's in the network and you go and you get your best possible benefit. But we always like to talk about the primary care physician, and that it's a good idea to establish yourself with one and to get any medical records that you might have over to them, so that in the event that you need care, that when you call up, they have a record of you on file, and they may not necessarily know you personally, but they at least have your records there, and you have established yourself as a patient. They might want you to come in and meet the physician just to, have a first time if you've never been there before. But always a good idea to try to set yourself up with a primary care physician. Okay, so I'm just going to touch briefly on the HMO, because I know the majority of the people on the call today are out of the DC service area. But again, this is showing you that the HMO, Wanda, hopefully you've flipped to the Blue Choice HMO Open Access Plan Highlights page. This just shows you that you do need to get a PCP if you're in the HMO, but you do not have to get referrals. You don't have to go to that PCP for your care, at all. If you're in network, if you're going to a lab, then you need to use the in-network lab, which is LabCorp. And then there is out-of-area services if you have an emergency or urgent care, but there are not any benefits if you go out of the network. So you must stay in the Blue Choice network. This is just a quick overview. You'll find all of these, the benefit chart, which is on the next slide. You'll find all of these located on the HR drive. There is a kit labeled with each of the plan names, and you'll find all the benefits, dental, vision summaries, all kinds of information in these kits. They're a wealth of information for you. So your HMO plan has a $1,500, $3,000 in-network deductible. The out-of-pocket maximum is there to protect you from any catastrophic claims. However, the majority of the claims that most people utilize would be processed at 100% or a small nominal copayment after the deductible is met. So you may never, ever get close to meeting that out-of-pocket maximum of either $4,500 or if you're a family or with dependents, $7,900. So I'm going to talk a little bit about the pharmacy benefits here, and then I'll talk about the Advantage and the PPO plan. This particular slide with the prescriptions benefit located on it applies to all three plans. So it doesn't matter which plan you choose, this prescription plan applies. So I'm only going to speak about it once, but if anybody has any questions, please put them up in the chat or save them to the end and we'll speak about it. Or if it's personal, please feel free to reach out to Wanda and she can connect you with me if you'd like to talk about a personal medical situation. So the deductible on all three of these plans applies to both your medical and your prescription benefits. So if you go get a prescription and you've never seen the doctor prior to getting the prescription, the allowable amount is going to go towards that $1,500 or $3,000 deductible. Once you've satisfied your deductible, then the co-payments are going to apply. So if you get generic, that's the tier one, it's going to be a $15 co-payment. Tier two, which is the preferred brand, is going to be a $35 co-payment. Non-preferred brand is going to be a $60 co-payment. And then specialty drugs are tiers 4 and 5, and they literally are what they're called. So a specialty drug is a combination of prescriptions that are made specially for you, and maybe 2 or 3 different prescriptions that the physician feels makes sense to merge them into one, one dosage for you. Those are a little more expensive because they're customized. So you'll see that after the deductible, they're reimbursed 50% up to, you would pay 50% of the cost up to the $100 max or $150 max, depending upon the cost. So again, once your deductible's met, then the co-payments kick in. You have maintenance prescription coverage. It's a 3-month supply, super easy to set up. You can do it, you do it online. They'll send you a notification that, your automatic refill, if you set that up, you don't even have to think about when to have it refilled. They'll mail it to you. You do have to put a credit card or debit card on the account so that whatever you're supposed to pay, they'll charge you. Once your deductible is met, then your co-payments, as you'll see, double. But if you recall, you're getting a 3-month supply. So you are saving yourself 1 month supply of co-payments by doing the mail order. Plus you're saving yourself the time of going to the pharmacy, of remembering to get the prescription filled. Notoriously, we were always, my husband was always really forgetful about when that prescription would get running low and would give it to me when he has 2 pills left, which isn't going to be enough time. So I put him on a mail order and it's working great. They send me a notification and tell me that the prescription's being processed, and it automatically refills and ships to me, and they charge my credit card. So if you take a prescription like every day, month after month, then you want to be looking at the maintenance prescription option, and you'll need to get your physician to write your prescription for 90 days and then get a couple of refills on it so that you don't have to continually have your physician do that. Now there's a tier 0, which says no cost drugs with no dollar amount in it. And CareFirst is pretty much the only insurance carrier that has these no cost drugs to the extent that they have. So of course they do the birth control pills. That's a federal mandate. So specific birth control pills, there's a no cost for them. But there's also other preventive type drugs that people take that are covered, and you would not have it go towards the deductible. You would not have a copayment on it. If you get diabetic supplies, that's an example of one. So if you're diabetic and you take a prescription for the diabetes, then You can get it if it's one of the ones that's on the list. You can get it at no cost. So that's a huge savings for someone to be able to help control their medical condition. There's Care First philosophy is that there should be no reason that people should not be able to get a prescription for a condition that can be maintained and controlled with a prescription. So once you're in the system, you'll be able to set yourself up with a My Account. You'll be able to go in and look at what that list of no-cost drugs are. And if any of your maintenance drugs are on there, that's a great plus for you because you get it without it having to go to your deductible first. Okay, next slide, please, talks about the Blue Choice Advantage plan. So this is the plan that I talked about in the beginning that has the access of using the PPO network if you are outside of the Care First service area. So this slide kind of breaks it down so everyone can see, where you go for what. Obviously, referrals are not required. If you're in the service area, you have to follow the same rules as the HMO. But if you're outside the service area, so we're going to look on the right side of this chart. If you go to a lab, you go to a participating Blue Cross Blue Shield lab. If you want to get in-network benefits, you go to a PPO national Blue Cross Blue Shield provider, and it's called the Blue Card PPO. And you'll have a little suitcase on your card to show you that you can use the national network. And across the United States, the providers recognize that Blue Card and they recognize that little suitcase. So you should not get any balance billing and you should get the higher level benefit. This plan also gives you out-of-network benefits. So if you have a physician who's not participating, you still have the option of using that physician. However, they may balance bill you for the cost difference between what's allowed and what's actually charged. So as much as possible, if you can stay in the Blue Cross Blue Shield network, that's your best bang for your buck. Okay, so our next slide is our benefit chart. And I'm going to get into a little bit more detail than I did on the HMO, but if you'll recall, the HMO had a $1,500 individual, $3,000 family in-network deductible. This plan and the PPO plan all have that $1,500 individual and $3,000 family deductible. So we kind of kept the theme going across the same, so the deductibles don't vary at all. Again, there is that out-of-pocket maximum that's to protect you in case you have any kind of catastrophic claims. However, you're going to have a lot of claims to reach up to that $4,500 because your claims are already processing at 100%. So after the deductible. So unlike some of the other plans out there that might say, deductible, and then you have to pay 20% or 80% is reimbursed. If you stay in network, once you've met your deductible, it's 100% reimbursement on things like office visits with primary care specialists, labs, x-rays, your specialty imaging, that's your MRIs, CAT scans, urgent care, emergency room, inpatient hospital, outpatient surgeries, all of those are paid at no cost to you once you have paid your deductible. There is an out-of-network benefit, and you'll see that the deductible is higher, out-of-pocket cost, maximum cost is higher, and then you'll also see that there's a percentage that you have to pay. Unlike the in-network side where you don't have it, once your deductible is met, you have to pay 20% of the allowable amount. So that means the insurance carrier is paying 80% of the allowable amount. And remember, if you go out of the network, the doctor can balance bill you for the cost difference between what they actually charged and what is allowed. Your urgent care and your emergency room follows your in-network benefit because, if you're out somewhere and it's, and you're not in a service area, can't find a provider that's participating and you need care, they don't want you not to go get the care. So those two are the only ones that you would not have to pay 20% after the deductible applies. And the in-network deductible applies to those two services. So that $3,000 doesn't apply on urgent care and emergency room if you are outside the network. Okay. Wanda, you can skip the next slide because that's the another slide on the pharmacy. So this next plan is the Blue Preferred PPO. Everybody's familiar with, how a Blue Cross Blue Shield PPO plan works. If you're in the service area, you get the largest, richest network. The doctors don't take as deep a discounts as they would on the HMO or the Advantage plan. So sometimes, you could pay a little bit more than you anticipated if you're balance billed, if you're at a PPO and go out of network. But it does give you that option. It's a national across the United States. So it works no difference whether you're in the DC area or whether you're across the United States. Whereas the Advantage plan, you have to use, if you're in the DC area, you do have to use the Blue Choice network, but if you're outside of that Care First Blue Choice network, then you're on the national platform, and it doesn't work, which is exactly how this plan works. So the next slide shows you the benefits, and if you recall the benefits from the previous slide with the Advantage, you'll notice that the annual deductible is the same in and out of network. The annual out-of-pocket maximum is a little bit lower on the in-network side. However, again, you're going to be really hard pressed to get up to that $3,000 as an individual. The first $1,500 is your deductible, and then you'd have another $1,500, but you're not going to pay anything for your physician's visits, labs, x-rays, hospital stays, urgent care, So it's going to take you a lot of co-payments on emergency room and a couple other services and your prescriptions to ever get close to meeting those out-of-pocket maximums on either the Advantage plan or the PPO plan. Again, just like with the Advantage plan, there is an out-of-network benefit, has a higher deductible, and you are responsible for 20%, except for the emergency room, and that one mirrors the urgent care and emergency room mirror the in-network side of things. We can skip the pharmacy, and does anyone have any questions about the medical before I move on to the dental? Okay. All right. Well, we'll talk about the dental plan. So this first slide on the dental plan talks about, shows you the name is the Blue Dental Plus. It's a nationwide access to your providers across all states. You can choose any dentist you want. So if you don't want to use a dentist that is participating in the Blue Cross Blue Shield dental program, you have that option. It changes the deductible a little bit, but it doesn't change your access. You may be balance billed for the difference between what they allow and what they charge, just like on the medical side. But you do have the option of going in and out. Obviously, your preferred dentists are going to give you the lowest possible, out-of-pocket costs, and then they have another level of participating dentists where the discounts aren't quite as deep. So it's going to cost you a little bit more out of your pocket to go to them. And then, of course, if you go out of the network totally, the dentist doesn't have to adhere to any discounts. So the benefit of using in-network dentists is that they've negotiated discounts for you that you may or may not be able to negotiate on your own. So our next slide talks about just what the benefits would look like depending upon what you're having done. So there's two different deductibles. If you stay in network, it's $25 an individual, $50 for family. If you go outside of the network, it's $75 for individual, $150 for family. Your $1,500 annual maximum applies to both sides. So if you use $550 on an in-network doctor, dentist, and then you go out of network for some other services because you know, your friend recommended them and that's who you want to go to, which you have that option, then you would have another $950 to use with that person. So between the two sides, you have $1,500 annually per person to use for your dental. Most of the time that should be good, and hopefully you don't ever exhaust it. But the upside is that your preventive visits, not only are they 100% processed, so no charge to you if you go to an in-network dentist, and you might get some balance billing if you go out of network, but they're paid at 100%, is that those dollar amounts that are paid for any preventive and diagnostic care, so your annual, well, your biannual cleanings and exams and bite wing x-rays and stuff, those are not going to go towards your annual maximum. So your annual maximum is going to be used towards your basic and major services, which is also what your deductible applies to. So go get your preventive stuff. It's not going to affect your annual maximum, and you'll have that in the event that you need it. You'll have that full amount to use, which is really nice. There's a lot of dental programs out there. Actually, both the dental programs you all are coming off of did not have that nice feature where they carved out the preventive costs from the annual maximum. If you need to have any basic services, that's going to be your fillings, extractions, that sort of thing. Those are going to be reimbursed after the deductible at 80%. Your cost is 20%. Major services, there's two different levels. Your major services that are considered surgical is your extractions, it's your periodontal care, your endodontic care. Those after the deductible are reimbursed at 80%. You pay 20% of the allowable amount. In the event that you need like crowns, bridges, implants, that sort of thing, once you've satisfied the deductible, then those eligible services are reimbursed at 50% of the allowable amount. Please know that there are some frequencies on things. So, you know, if you get some major work done and you need to have something else done, please always submit a pre-treatment estimate in. If your dentist wants to do any work that is more than, you know, $250, $300, that way you know exactly what's covered, what's eligible, so you kind of can plan accordingly with your finances. Again, there's out-of-network benefits. The benefits mirror other than the deductible, and of course, the dentist can balance bill you for the cost difference if there is one. So your vision plan, which for some of you is new and you've never had before, is also offered through CareFirst. Again, it's a national network. There's nearly 60,000 providers across the United States that participate with the Davis Vision program. It's going to give you your preventive eye checks, your glasses, contacts. It's going to help offset some of the cost for that. The beauty of using CareFirst, unlike some of the other vision programs out there, is in addition to those providers in the Davis Vision network out there, they've also contracted with some of what we call the big box providers. So your Sam's Club, your Target, your Walmart, those sorts of places where it's a one-stop shop. You get it all at once and walk out the door, as opposed to going to an optometrist or an ophthalmologist for your exam, and maybe then you have to go somewhere and get your glasses. This particular program allows you a lot of flexibility. So our next slide talks about the vision benefit itself. All of the vision benefits are on a 12-month rolling basis. So if you go get your eyes examined and get glasses in August of this year, then August of 2021, you'll be eligible for your benefits again, which is nice because there's a lot of plans out there that will let you get your eye exams and change your lenses once a year, but your frames you have to stick with for 2 years. So this particular plan allows you to get a new pair of glasses every year. So that can help you build up if you want to have maybe a pair at work and a pair at home, or you want to have sunglasses done, that sort of thing. Your eye exams are $10 copayment if you stay in the network and go to a Davis Vision provider. If you get your frames through a provider, there's 2 different tiers of how you can purchase your frames. So the Davis Vision frame collection would be no cost. If you want to get designer frames, which are not in the Davis Vision collection frame, you're going to get $45 towards those designer frames, and then you're going to have to pay the balance. Now they do a discount. So, if your glasses come out to be, after the discount, $200, you would get $45, and then you would only have to pay the cost difference. The lenses that go inside the frames, this plan does not have any cost for those. So that's a really nice perk. A lot of plans have a cost for your frames, for your lenses to go in the frames. So there's no cost for that. All you're doing is paying for the frames, and then whatever lenses you need are covered. Contacts, again, works the same way as the frames. Stay in the Davis Vision collection, and there's no cost. But if you go outside of it, then there is a cost. You'll need to check your benefit summary for more details on this. They do allow for some options. So like if you want to get progressive lenses, there's an allowance allowed for that. And then, of course, if you want to get laser correction, you can get discounts off of those services. Now, if you want to go out of the network and not see an in-network provider, you'll see on the right side of the chart that there are, the plan will pay $45 for frames or for the exam, and then you pay the balance. Same thing on the lenses. There are co-payments. Well, not co-payments. There's an allowable amount per type of lens you get, whether it's bifocal, single vision, whatever it is. And that's all located on the benefit summary for you guys. Just giving you kind of a snapshot overview in our presentation today. Okay, so our next several slides talk about the technology and some perks that are available through Care First. So the first slide is My Account. If you've never had a Care First Blue Cross Blue Shield account before, you'll want to get yourself set up with a My Account. If you have one, then you're going to need to set yourself up because you're going to have a different group number, possibly. No, I might retract that statement. Let me check on that if for anyone who is has ever had a Care First plan. Just make a note real quick here on whether or not you guys would need a new login. But if you've never had it, please make sure you get yourself set up. It's a wealth of information. You can do it on a mobile app. You'll be able to search your providers, look at your claims, see how it's paid. You'll be able to look at your benefits, print an ID card. And then there's all these great estimators in here where you can go through and look up some stuff within it. So it's great to have on your phone. You can check doctors, while you're at the beach and find the closest urgent care if you need it. So the next slide talks about the cost comparison tools. Within your My Account, you have these cool estimators where you can look up a treatment and get an estimate for your area of about what it's going to cost. It will give you provider comparison information, so you can get information about providers and hospitals. You can do a comparison to see, which one is Spanish speaking, which ones aren't, that sort of thing. And then the really nice tool that I always tell everybody who is on a plan with a deductible that applies first is the drug pricing tool. And this gives you the ability to be able to go in and, like I was saying earlier, look and see what prescriptions you're taking, what tier they fall under, whether they fall under that no cost tier. Will give you the price of how much each of those prescriptions cost, because across the pharmacy world, every pharmacy charges a slightly different amount because they have slightly different negotiated rates. So, CVS historically is more expensive than any of the other pharmacies. However, sometimes they're not. So when you're paying for your prescriptions, first dollar until your deductible's met, it never hurts to go in and see if you can save a couple dollars each time. It's not going to be, you're not going to see differences like, CVS is, $20 higher for this prescription. Well, I shouldn't say never, but rarely. What you're going to see is a much shorter difference in the amount. You're going to see a couple dollars. Usually I see under $5 between the two. But, if you can save a couple dollars, why not? That's always my philosophy. Why pay more than I have to? The next slide talks about finding a provider. There's all different, you'll be able to search for your dental, your vision, mental health, pharmacy, and all kinds of medical care. If you go through your My Account or you do it off your app through your My Account, it's going to know which medical plan you're on. So it's going to know which set of doctors to send you to. Same with the dental and vision. It's going to know which plan you're on. So that's why I can't stress enough to set yourself up with that My Account, because it's going to take you to the providers and you don't have to go through and go, oh, which one am I picking? What am I doing? The other thing is, for anyone who is outside the Care First service area, when you go in here, it's going, you're going to put in the zip code of where you're searching for providers, and it's going to know that you're outside the Care First service area, and it's going to redirect you to the Blue Cross Blue Shield National Network. Okay, so you'll know when you're moving outside. It will tell you. Okay, so our next slide, I just want to spend a couple minutes on this one. It's called Know Before You Go. And it kind of, as it goes across from left to right, you'll see the dollar signs below, and you'll see, there's a little cost, and then it gets more, and then by the time you get over to the emergency room, your cost is higher. So know that your primary care physician is there. They're the first to call if you have a medical situation that you need some advice on or you need an appointment. If it's life-threatening, please don't call your primary care physician. Call 911 or get to your nearest hospital if time permits. We don't want anybody to lack care because they're trying to make phone calls. But your primary physician is there to help guide you to where you need to go. Maybe you don't know a dermatologist to go to, or maybe you are having chest pains. Then you're going to call 911 and make sure that they know who your primary care physician is so that they can make sure the hospital is getting in touch with them. If you just need some advice in the middle of the night, maybe you wake up and you suddenly have a rash on your arm, or you have a child that won't settle down, or they have a fever and you're not able to get a hold of your primary care physician, and you don't feel you need to go to the emergency room just yet, there's a nurse. They're 24 hours. You can call them and ask them any kind of medical advice. So if your doctor talks to you about a situation and you'd like another opinion, the first nurse line is there for you. It is no cost. The other thing that you can do without ever leaving your house, and I'm hoping that some people have tried this out over the last couple of months with the stay-at-home orders, is the video visits. I've been talking about these for the last couple of years. They are a great thing. And a lot of people have found out over the last couple of months just how great they are. You set yourself up with an account. You will have to put your credit card or debit card into the account for them to charge whatever is the going rate at the time that you see the physician. But it's video. As long as you have a camera on your phone, laptop, tablet, you'll be able to video conference with that physician. The beauty of it is that, it's great for those simple things and you never have to leave your home. So upper respiratory, if you have a rash, pink eye, you have, your stomach flu or something like that. Strep throat sometimes can even be seen if if the physician feels comfortable with what they're looking at, because they're going to ask you to look in your throat if you're saying that your throat is sore. Obviously, they can't look in your ear, but they can definitely look in your eyes and your throat and that sort of thing. If you have a broken bone, this is not the place to go. You're going to go to urgent care, or you're going to go to the emergency room. If you need an x-ray, the video visits is not what's going to be good for you. But the other nice thing about the video visits is that they are physicians and they can write prescriptions, and they will call them into a local pharmacy for you. So that's really nice. Both of my daughters at college have used the video visit, and it's really nice because they've never left their apartment. They've never gone, they send somebody, one of their friends or roommate, down to pick up their prescription. And, they didn't procrastinate. That's the biggest thing. And I know I'm just as guilty. I tend to think, oh, tomorrow I'm going to feel a little bit better. And then tomorrow I'm not any better and I'm actually worse, and maybe I should have gone the day before. So check out the video visits. There is a cost. I'll talk about that on another slide. But it's nominal compared to everything else. The CVS is having the minute clinics. There's a couple of other type of convenience care centers that are located in like pharmacies that are up and coming. CVS is going to be ramping up, and they're going to be making their minute clinics a little bit more like urgent care. So you're going to have privacy. You're not just going to be sitting in a chair in CVS over in a corner talking, privately to a physician behind a plexiglass wall or something. They're going to start building some rooms and making it more like going to a mini urgent care type facility. So watch for those type of things to be happening more and more across the U.S. Those are available for you to use. Of course, urgent care centers, they've been around for a couple of years. They've ramped themselves up so that they can do, simple labs and x-rays, so they don't have to send you to the emergency anymore. And then, of course, the emergency room is always available to you. Just know that, if it's a life-threatening, this is where you're going to want to go. But if it's not life-threatening, check out some of your other options, because there's a lot more options out there than it used to be than just going to the emergency room. It's going to save you money, and it's going to save you time, and then you're not going to be exposed to a lot of other people who are in there because they don't feel well. Yes, I just moved to that one. So the Care First video visit slide, we talked about on the last slide in more detail, but what I want to point out is that because you guys have the deductible that is subject first, if you use the Care First video visit, the most that you're going to be charged is $49. So this is a great way to save a little bit of money by not going to your physician if you can do a video visit instead. And again, it's for non-emergency, uncomplicated health care. So our next slide is Take the Call. And this is a program for people who have ongoing medical conditions or they have health coaching that they're interested in. So at some point, depending upon what your claims history looks like, Care First may reach out to you. So you might get a call from a nurse or a health coach or a pharmacist to talk about your care that you're receiving. So it's a legitimate call. As they say here, takes the call. They're just there to help you and make sure that you're getting the proper care that you need, that you don't have any questions, and that you're comfortable in what's happening. They can also help a little bit with, if you have a question about your claims, but mostly they're there for any medical advice. The next several slides, starting with this blue 365 slide, is about wellness, either health or financial wellness. You have a wellness discount program baked into your Care First plans. To be enrolled in these programs doesn't cost you anything. They're free. And the discount program will do things like give you discounts for gym memberships, some family activities, maybe your fitness gear. Maybe you want to buy a Fitbit, you could get some discounts on that. And then there's also discounts on healthy eating options. And they change all the time. So even if you don't see initially when you go in and look, check back in a month or two and you might see something in there that appeals to you at that time. The Wellness and Incentive Program is partnered with ShareCare. And this new wellness program kind of puts the power of your health back into your hands. You can use all kinds of personalized online tools. You can do it through your laptop, you can tablet. There's also a mobile app. This slide talks about the wellness resources that are available through this program. So you can connect your Fitbits, your Garmins, all of that to this program. You can get recommendations on health timeline. Maybe you've got some goals you want to set. They'll come up with some challenges. And then the other thing that they have is the Real Age. And the Real Age is an online health assessment that it will compare your physical age based on the answers to your questions against your calendar age. Some people have seen it the both ways, where they're 36 years old and they're being told that they're 54 based on their answers. So that's telling me that you got to get up and move and start, exercising, get away from your desk, take a walk at lunchtime. Or maybe the other way, and you're, 45 years old and it's telling you that, you're 31. That means, you're really getting out there and you're taking charge of your body and your health. So there's all kinds of these types of programs online that people do, surveys and but this is one that's available and through your Care First and tied to it. Again, this program gives you, some coaching, will help you with weight management, tobacco cessation if you are interested in kicking the habit. And then as the other piece on this one slide shows, you can also get some assistance and resources for your financial well-being, because it's not just about your health in wellness. You got to make sure that your financial well-being is good too, because they go hand in hand. So this next slide talks about your Blue Rewards Incentive Program, and that's kind of tied to your Wellness Real Age program. Well, actually, I shouldn't say it's kind of tied. It is tied. That's just one component of it. So what this allows you to do, it's purely voluntary, as are all of these perks. You don't have to use any of them, or you can use all of them, whatever you would like to do. But the Blue Rewards program gives you money back. to help offset some of your deductible. So in addition to that HSA money that the company's giving you on a monthly basis, you can also earn some money through this incentive program and then have that help offset some of your deductible. You do have to do a few things to earn some money, and you'll see that there's 3 buckets of money you can earn: $100, $50, and $25, depending upon what you do. The first one's pretty easy. Just takes a little bit of time. You have to go to a primary care physician or a CVS Minute Clinic and complete a health screening. You also do have to choose a primary care physician and designate someone. This particular program you need to do within 120 days of July 1st. That's a long time, so hopefully anyone who tends to procrastinate can get it done in that time frame if you're interested. But if you go and you select your PCP and you get your health screening, submit all of that in to Care First, they're going to put $100 on a debit card for you, a little, I believe it's a Visa card. And you can, like I said, you can use that to help pay some of your deductible or your co-payments if you are at that point. If you want to earn an additional $50, you have to take another step and you have to agree to receive wellness emails. We all get all kinds of advertisement emails, so a wellness email is just one more avenue. And then you have to do that real age test that I talked about on the previous slide. If you do those 2 things, you can get an additional $50 put on your card. And then if you retake the real age test, you can earn an additional $25 for retaking it after 6 months. So the idea is, if you do the first 2 things and then 6 months later, you take the real age test again, hopefully you'll get better results because you've maybe made some lifestyle changes, but you can earn an additional $25. Now, with your high deductible plan, you do have to earn a portion, you do have to satisfy a portion of the deductible before the debit card kicks out to you or is funded, but you do have the option of having that money if you're interested in earning it. The next couple of slides talk about the HSA. And Further is the company that administers the health savings HSA account. As we mentioned, the employer is funding a portion of it on a monthly basis. You can also fund additional amounts into it every paycheck if you would like. There is a form on the HR Drive to have additional money taken out of your paycheck on a pre-tax basis. And then there are limits. So there is a limit of how much the IRS will let you deposit into that account on an annual basis each year. So there is a flyer in there that shows what it is for 2020 and what it is for 2021. If you currently have an HSA and you're going to sign up for the HSA with the health plan with Care First, you're automatically going to get signed up with your HSA account with Further. So if you already have an HSA account somewhere else, you have 2 options. You can leave that HSA account elsewhere, or you can roll it over into this account. If you would like to do that, we can talk individually with each person. You have to have qualified healthcare expenses to take money out of the HSA. It works very similarly to an IRA where you have to be a certain age to pull the money out, but it can be used on any family member who is on your high deductible plan. It also does not work like an FSA, so it rolls over from year to year to year. You can use it for dental and vision. I highly recommend that you make sure that you have enough to cover your your deductible before you start tapping into your funds for dental or vision coverage. You will automatically get set up into an HSA account with Further if you choose the medical. And just remember, you're going to have money deposited in from the employer. So you're going to want to go ahead and finish all the process of anything you need to do to get that set up. So pay attention. You're going to get some information directly from Further Care First on anything you need to do. And when you're in the, so the next slide talks about going into the your account. So in order to get into your account to look at stuff, you're going to see the access to get to your Blue Fund account is what it's called with Further. So you're going to log into your My Account. You're going to log into your Blue Fund account if you want to toggle over and look to see how much funds you have in there, what's been processed, and that sort of thing. You're going to do the drop down under coverage. Second one down is Blue Fund Administration. You click on that, it's going to toggle you over. The other thing you can do is go under the search under what can we help you find and go to the balances and transactions tab. That will take you there as well. These slides are probably a little bit harder to see unless you have a really big screen, but it kind of walks you through, you know, how to review your account. You have your balance, recent activities, your statement. You can put beneficiaries in on your HSA. You don't have to, but we recommend it because if something happens, then that money needs to go to someone. You can search eligible expenses, and then of course you confirm and agree wherever you are in here. You can get reimbursed by just going online. So say your debit card that you received didn't work when you were at the pharmacy, or your physician asked you to pay $10 as a good faith until the claim is processed. We always recommend on the physician's labs and x-rays and that sort of thing to really not pay a whole lot unless they tell you that they are linked up with the Care First program and they know exactly what the discounted amount is going to be and what is applied towards your deductible. Otherwise, please hold off and let that claim process through the Care First system and then go back and make payment to your provider. So if for some reason you paid for something up front and the doctor is paid in full or the pharmacy is paid in full and you want to reimburse yourself, you can go online and do it, or you can upload to a paper claim. You can also do a cool feature in here where you can pay a bill. So if your physician tells you you owe $50 and you've waited for it to process through, you get a bill in the mail from them, you can go ahead and process it all online, or you can do it the way we've always done it, which is work directly with your physician, pay it over the line with a credit card, or mail them an actual check. So that pretty much is it. Just want to recap a couple of things. Make sure that you set yourself up with a primary care physician. They can be your, gateway to knowing where to go without having to go to a bunch of doctors that aren't correct for your condition. Saves a lot of time. Remember your preventive care visits are a federal mandate. So your well woman, your annual physicals, and your child wellness visits are all covered, no deductible, 100%. Go get those visits just like you would for your dental. You just need to get those on an annual basis, or if the children, they're on a specific timeline. Pay attention to, if video conferencing would work for you versus just going straight to the emergency room or urgent care. And get your forms in, uploaded to the HR Drive by Wednesday, July 17th. If you have any questions, we're going to open up the line for the last 5 minutes or so that we have with you guys. If there are specific questions about your personal, if you feel more comfortable not talking in this forum, you can set up an appointment to talk directly with me, or if Wanda can answer your questions, she is also available. She'll be your first triage to all of your questions. So I thank you for coming. And if anybody has any questions, please speak up, and we'll be hanging on the line for a few minutes longer.